Hey there, this is Dr. K. I wanted to talk with you about what my ultimate ends are for patient care, and it's always to go deeper, much deeper than you would realize and what you really came in for. Most times patients come in for the symptoms that they're experiencing in the moment, and that's totally okay. But my job is really to take those off the table, but also to go deeper, to find those root causes that really gave rise and manifested the things that you're now experiencing. I like the analogy of the iceberg. The iceberg, the tip of the iceberg, which would represent all those conscious pains that you came in for, and the hidden portion that's unseen beneath the water. Those are those unconscious pains that are yet to be discovered, because really what's happening is our brains can only handle so much input, and it's going to prioritize the injury that has the most fire behind it, the most inflammation, and those other pains it won't even bring up because it's just too much, so it'll leave it beneath the surface. After primary pains are dealt with, then secondary and tertiary pains really come to the forefront. My job in going deeper is to show you that it's never just that one thing that you came in for. There are other things, there are other issues that are at play because we walk on two legs, and everything is accommodating and coordinating such to keep us up on those two legs. And so there's lots of injury processes that are going on without your knowledge of really ascertaining just the complexity of how our body is working for us at all times. It is important for, in our going deeper to reveal those hidden forces, those hidden pains that are going on. I look at myself as an archaeologist, in some sense, because there are layers of time that need to be gone through. And, many times with patients, there are things that I'm clearing off from decades, from childhood. And it's pretty awesome to see the things, the issues that have stymied patients for a long period of time be finally cleared away. And it brings me a lot of gratitude, and it's super awesome for patients to see that they can go much deeper for themselves and not just live with pains that they were told by many that they were just going to have to live with as a condition of their existence. And I do not accept that as being true. My ultimate end really is to create suppleness out of rigidity, because in our bodies, as we age, we start out in life as a baby and everything's supple and, like a marshmallow and a gummy bear had a baby. That's the kind of tissue tone that's going on there. But as we age, work, gravity, weight bearing, repetitive traumas of our lives through work, things become rigid, and that's where breakdown occurs and vulnerabilities appear. Not that we're flawed, but we create these situations in ourselves. So really from birth to death, suppleness to rigidity, it is our responsibility as we continue to age to return to suppleness as much as possible. Stretching, good activities, good movement. I want full range of movement, no pain. I want to be able to go through with force, to your body, from superficial to deep, without pain. That's really where you should be. And muscles, tissues should have the tone of suppleness. I'm excited for you to, with the progress in rolling and through our care together, to experience in yourself this life of really discovery in what your body is capable of doing and how far you can bring yourself. Because what that means is more biomechanical efficiency. You're going to notice things about your environment that don't work anymore, that really you adapted around before, but really just, no, they're not working. So it's really important to participate in this progress that you're making and to understand that everything is within our control to help ourselves. Thank you.